wanted to trace back a month ago because I went overseas for a hiking and I had a fall. I thought the pain was, the fall was actually the one, there is the reason why it caused the pain. So I applied some ointment and I thought the pain would just disappear. But after a few days later, the pain started traveling to my calf, my thighs. So I was wondering what has that to do with my back. And it continued. And it was very, very excruciating. In fact, at night I wasn't able to sleep.
Back pain is actually really common. In fact, it's one of the most common causes of disability worldwide. It affects many people, from the young to the old, to the active to the inactive, to the desk-bound teachers, to the mechanics working outfield. One of the most common causes is usually a muscular strain. We see this a lot. Patients who exert themselves in the gym or working too hard, occupational related activities, standing too long, posture related problems can cause back pain. Another big group I see, which I believe is Vick's case, is due to degeneration. So Vick, you can see this is a lumbar spine, and you can see these are bones, and this is a disc. Okay, or we call it the cushions. So what happens, you can see over here, there's one of the discs has popped out, called the slip disc. You don't have it over here, but it's over here. If it slips out, sometimes you can touch the nerve or pinch the nerve. So if there's nerve compression, patients may feel severe pain shooting down the leg. The term we use is called lumbar spondylosis or lumbar spondylolisthesis, where there's some instability causing them to have back pain. Other degenerative cases that can cause back pain are due to scoliosis or slip disc as well.
Yeah, okay, yeah. My main hobby is actually reading books. And in fact, I'm also an author. I'm writing my second book. I intended to actually complete the book by end of last year. I wasn't able to because even when you go to the laptop, you are just being overwhelmed by the pain. Even if there's no pain, you may think that the pain may just come.
So physiotherapy works holistically to restore the complete mobility by addressing movement impairments and the biomechanical issues of your body. For example, joints, muscles, soft tissue, and so on.
Hi, nice to see you. I was referred to you by Dr. Jacob.
Whether from an acute injury or chronic conditions. I would like to recommend lumbar mobility and motor control exercises for Mr. Vick's conditions.
Okay, let's roll forward. Good. Tailbone up and then sit all the way, tailbone down. Good. And up. Good. Well done. And down. And up. Good. And down. Okay. Good. Yeah, done.
Okay, thank you.
How do you feel?
Much better.
Okay, that's good.
These can help to strengthen and recondition his back and trunk muscles to move his back and support his back better, reduce the pain and relieve the strain. Over time, Mr. Vick may have greatly reduced in his pain and he may even be pain-free at times.
Oh, the bridge.
Yes, correct. You learned before. Very good.
I know the bridge.
Yes, okay, then just leave the laptop up.
Unfortunately, most cases can be managed conservatively. Patients with a muscular strain, they're usually self-limiting and gets better within a few days to a few weeks. Things like conservative treatments such as medication, physiotherapy, activity modification and rest, And usually they do quite well with these conservative modalities. Surgery is usually the last resort. I would say that 90% of cases do not need any form of intervention, and only when the patient's symptoms are very, very severe, very disabling, then surgery is an option. These days, surgical treatment has advanced quite a bit, and you can use things like keyhole techniques that can be relatively safe, lower risk, with minimal downtime. But that's usually when it's at the very last resort and the patient has failed conservative treatment. I would suggest patients come to seek emergency treatment when they've experienced any of these red flags. They've got severe back pain that's radiating down to their legs, they get numbness, they get weakness, or they have problems controlling their bowel and bladder habits. And these are usually a sign that the nerve compression is quite severe, and that's affecting their legs and their sensation that's going down their lower limbs.
I went back to the polyclinic and they referred me to Tan Tock Seng Hospital. And at Tan Tock Seng Hospital, of course, the doctor, he recommended me to continue taking the medicine, and he gave me different type of exercises in addition to the original exercises. And yeah, then after that the pain disappeared. So now I can say I'm almost cured. On and off I have some lingering pain, but it's a far cry from what I was a couple of months ago when first the pain came.
The first line treatment is rest, physiotherapy and medication, but doing massage and TCM is possible, and there's not much harm to try this as well.
The doctors treat us, but the patients play a very pivotal role in the curing of any disease. Sometimes you find that if you are not a kind of person who do such exercises, you have to force yourself to do it, because I think that's one best way to cure.